My name is Sanjay Gupta. I'm a consultant cardiologist, and as you can see, I've got a bit of free time today, thank goodness. But today I thought I'd do a little video on the subject of how to make the most of your visit to see a heart specialist if you're going to see him for your heart palpitations. A lot of people I know have contacted me because they're troubled with symptoms of palpitations, and many of them have to go and see a heart specialist, and a lot of them come back and say, well, yeah, he didn't listen to me, or I didn't feel he listened to me, it was all a hurry, and I didn't feel adequately reassured, etc. And so I thought I'd do this video really to try and see if I could help you make the most out of your visit to go and see a cardiologist. All right, particularly with relation to heart palpitation. The first thing to say is that there is a range of different cardiologists. Okay, there are some people who have very good communication skills. There are others who unfortunately don't have very good communication skills. However, there is little doubt in my mind that if the patient goes and is prepared adequately and makes the consultation succinct and is able to provide the doctor with the details that the doctor wants without the doctor having to do too much work, then that will undoubtedly make for a more productive consultation. So, it's important to just bear in mind that although this is a very different thing that's happening to you, when you go to a doctor, he's probably been seeing patients with similar complaints all day. And when he's doing this, as with everyone, they're running late often, they're pressurized for time, they're generally somewhat bored because they've been doing that all day long. So it can be incredibly challenging for your doctor to show enthusiasm, etc., and show interest in you if he's having to do a lot of work to try and work out what's going on. If you can give him all the answers to the questions he is going to seek, then it'll work out in your favor. So if you're going with heart palpitations, here are the things that you should be thinking about, because these are the important things that he's going to want to know from you when you go and see him. The first thing to talk about is your symptoms. Okay, it is very, very important to realize that in general, when you go to see a cardiologist, they're only really interested in probably 4 sets of symptoms: chest discomfort, breathlessness, palpitations, and dizziness or blackouts. And with all these symptoms, they're going to be interested in knowing whether they occur on exertion or not. And the reason for that is because it is when you exert yourself that you challenge your heart. So if there's a subtle problem, it will first show up on exertion. So what I often find is people will come to me and they will have a multitude of different symptoms. So they'll complain of breathlessness, and they'll complain of chest pain, and they'll complain of palpitation, and they tend to mix those up. So they'll say, yeah, and then I've been struggling walking, and you say, well, what happens then? Oh, I get breathless. And then you'll say, okay, so you get breathless on exertion. What happened on this day? Well, I was walking, and that's when I had palpitations. And I said, so do you get palpitations with the breathlessness? Oh, no, I mean the breathlessness. So that makes it much more challenging for the doctor. So it's very important in your mind before you're preparing for your cardiology appointment to write down exactly what you get. Often people do not get chest pains, they get discomfort. The doctor is interested in knowing about discomfort. Okay, a ton of people come to me and say, well, I didn't get any chest pain, but I do get this ache or whatever. So discomfort is more important than pain. And if it is pain, then you say it's discomfort to the point of pain. Anyway, so the first thing I would recommend is say, what are my symptoms? Am I getting palpitations? And then you have to say, what does a palpitation mean to me? What is a palpitation? What do I think is a palpitation? Or what is happening to me to make me think it's a palpitation? Am I noticing my heartbeat when I shouldn't be noticing it? If I am, is it just a normal heartbeat in the sense that it's not going fast and it's normal and regular, or is it an abnormal heartbeat? Okay, so often it helps to say, well, yes, I just find that I am getting a heartbeat that I can sense, which feels much more prominent than normal, but it's not faster, it's not irregular. So when it's palpitations, they'll always be interested in knowing, is it fast? Is it irregular? And it's important when you're, for example, lying there having palpitations, thinking about going to see a cardiologist, to write that down and say, well, look, you know, it's fast or it's regular. And if it's irregular, is it irregularly irregular or is it regularly irregular? I.e., is it like this? That's irregularly irregular. Or is it like this? So that's irregular, but it's regularly irregular, whereas the previous one is irregularly irregular. So it's worth writing those things down. The second thing they'll be interested in knowing is the onset and the offset of the palpitations, okay? Does it come on suddenly or does it come on gradually? Again, very important to write that down, because sometimes it can be very difficult when you're in the consultation room to try and think of these things. So think of it. Does it come on like a light switch? Does it come on so it's like, or does it more? So you see, the second one was more regular, more gradual, whereas the first one was just sudden, like a light switch. It comes on, and then once you've got that, then they'll want to know: does it go away suddenly or gradually? Okay, if it goes away suddenly, then it will feel like a light switch. It'll be like, oh yeah, I feel better, it's gone. Or does it go away gradually? Another thing that is very useful to tell them about is at what first is it associated with any other symptoms? Do I get chest discomfort when I have it? Do I get breathless when I have it? Do I feel lightheaded or dizzy when I have it? So again, number 3, put that down if you get any other symptoms with it. Number 4, it's very useful to say, is it situational? All right. If you say, I get it on exertion, that's a situation, and that's very important. Similarly, you could also work out whether does it happen when you're not exercising? Does it happen only at rest? Because that gives the doctor clues, you see. If it's exertional, it's perhaps more important than if it's only happening at rest and not an exertion. Because if there were a problem with the heart, you'd surely expect it to be more when you exert yourself. Then it's also worth saying, does it happen at certain times during the day? Some people will complain of palpitations first thing in the morning. All right. Others will say it happens last thing at night. Some people may say, you know, it only happens when I'm at work. So that's very useful. It's also very useful then to be able to tell the doctor whether you are going through any stressful events or whether it's been preceded by any particular stressful events. So again, you know, in the heat of the moment, when people come to a clinic, they don't think of all those things, but it's worth just saying, well, has something bad happened to me? Am I going through a marital breakup? Am I going through a change in my living circumstances or to a new job? And that's really useful information to give to your doctor. Another thing that's very useful to tell him is your family history. And the particular thing they would be interested in knowing from your family history is if there's a family history of sudden death. Okay, someone in your family dropping down dead suddenly. That's what they're really interested in, because that's a high risk feature, and that's worth telling them. If you have any old notes, any previous ECGs, it's always good to take them with you. Similarly, it's really, really helpful for the doctor for you to bring a list of your medications with you. All right. Any kind of information that you can go and present your doctor so that he doesn't have to go searching for it is going to be useful. Because remember, the more he searches for it in a limited period of time, the less time he has to tell you what it means. So the less work he has to do beforehand, the better it is for the consultation in general. Because ultimately, you want him to reassure you. You want him to tell you what he thinks. But you have to then furnish him with all the information, either before the consultation by giving this information to his secretary, or maybe going with it over there. But try and make his life as easy as possible, and that would help. So lists of medications is important. Your family history is really important. And the other thing, of course, worth talking about is triggers. Okay, very important to think of triggers and tell him what the triggers are. Do they happen when you're menstruating, if you're a female? Do they happen in relation to alcohol? Do they happen in relation to suffering from indigestion? All right. It is very important also to tell your GP doctor, and he may not ask for it because not many cardiologists are, necessarily look for it. But if you are overweight and you have problems sleeping in particular, you may have sleep apnea, and sleep apnea can cause palpitations. So it's, again, very important to talk to him about that. Now, so that's what I would recommend when you go and see him. I'm just trying to think if there's anything else. Oh, finally, I think it's also very important to see if you can tell the doctor whether there's anything you can do to take the palpitations away when they occur, and or whether they can't. Some people, sometimes they can press on the neck and the palpitations go away. It's very important to tell him things like that. How frequent the palpitations are. Do they happen every day? Do they happen once every 3 weeks? Do they? And I know it can be very difficult to quantify because they can come on, but just give him an average. So he's not going to have to try and work out what the frequency is. You just saying, look, on average, I'd get them 3 times a week. And when I get them, they last 15 minutes. That's really useful. And if you give him all this information, you will have a far more productive consultation. And you'll come back hopefully reassured. So I hope this was useful. And if you, as always, as is the done thing, I normally talk about my website. So here it is. So my name's Sanjay Gupta. I work in York Hospital. I have a Facebook page, which is York Cardiology. I have Twitter, and I have a website. A lot of people have contacted me and asked if they could come and see me, and you can do so if you'd like. You can ring my secretary on 01904725811. Her name's Jeanette, and she's lovely, and she'll be able to help. So all the best, and take care, and thanks for listening to this. And I'd really be grateful if you could like and share my video. Thank you.